How's it going? I'm Jeff, the OT dude, and I'm a licensed occupational therapist. In this video, I'm not really gonna have any thing written down or planned ahead. I'm gonna be talking about basically why I do not regret choosing occupational therapy. And hopefully this can inspire those of you who are trying to become an occupational therapist, those who are currently OT students and in school, new grads who may have been discouraged, unable to find a job, or even more longtime OT practitioners and codas out there who may be getting burned out, maybe even regretting choosing OT. So one thing recently that really kind of re-inspired me for OT is my pain story. And those of you who do not know, I have gotten injured about 2 years ago, and I have currently still experiencing some chronic lower back pain. And basically, pretty recently, I have decided to stop doing my OT day job as an occupational therapist who works in the hospital in doing acute rehab and acute care. What I wanted to share with you is basically how it's kind of embarrassing, but I neglected to use OT on myself. And I kind of took the passive approach of what most kind of patients would take when it comes to treating their pain. That's not to say, and this video is not to kind of knock other professions and say that OT is the best, but one point in just kind of pearl of wisdom is that pain is very subjective and it can be also very personal. So what did work for me or what didn't work for me may not be the same case for you guys. And it may very well work for you because everyone's different. Everyone's built different. They come from different backgrounds, different cultures. Your body's different, your gender, if you're a female, and so on and so on, even your pain tolerance. So basically, I have a really good doctor, and it's actually, she's a nurse practitioner, but she's really great. And she really advocated for me to not do surgery and to not seek that out and just to do conservative methods. And I think that's basically a pretty good point there for those of you who are experiencing pain, and is to try and be very conservative because surgery does come with its risks. It's not to say that don't ever do surgery at all. There is a certain time and place for surgery, but it can come with a lot of risk and complications too, let alone cost, like lost time from work, lost time from family, stress, and so on and so on. So for me, I'm really glad that my practitioner advocated for me to not do surgery and to just seek conservative things. And that combination was basically doing physical therapy and also medications. So currently for medications, I'm on a pretty low dose of tricyclic antidepressant, and that helps manage my both twofold, really, my anxiety and also my nerve pain for my neuralgia. And so starting with the medications, I'd say the thing about that is I was always kind of not a person that liked to take medications, and I have been pretty wary about doing the more heavy stuff, so to say. So basically opioids. So, the opioids, I think in my recent research about it, I've always had this kind of stigma about how oh, it can cause addiction, but now I think I have a more broader view of it, and I think it really has its place, and especially for older adults, because opioids, they are very effective, and they have, although they do have side effects, they do not, cause as much organ damage and other long-term damage for patients compared to the other things that are out there. So I think if you start low and you titrate up and you work with your provider for opioids, it can be really helpful in managing both acute pain and chronic long-term pain. The issue comes when, and I don't want to get into the controversy of it, is probably when people may not be able to get what they want or they need, such as due to changes in law, and they may have to go on and get it illegally. And that's when you go into the realm of, well, what does this thing actually contain? And is it the right dosage? And you may be getting other things with that drug, or maybe a higher dose than what you perceive it to be because you really don't know. So for me, I think having that really helps, like a very low dose. And the downside to that is, well, whenever you don't have something like the medication, you run out or you forget to take it, then you may experience like a peak or a kind of more increase in pain, right? And I also have some side effects too. So, well, what else did I try? Because that wasn't it, even though I tried that, it didn't completely eliminate my chronic pain. And even though I went off of it for a while and on and off, because I was like, okay, maybe I don't need this anymore, my pain kind of came back a little bit more. So physical therapy, right? So I'm all for physical therapy, but the thing with it was, I wasn't really engaged with it because I did outpatient PT and, they gave me these exercises to do. And I don't know about you guys, but for me personally, I hate doing exercises. Even when I was really into going to the gym, I was really just there. And although I went pretty regularly before COVID-19, like I'd rather do something else besides exercises, like doing something more interesting, So I wasn't engaged with the exercises. Like I understood the premise before it, being that an occupational therapist myself, but I didn't really stick with it. And even then, like I was discharged pretty early and they're like, hey, Jeff, you're doing pretty okay. Like, oh, here's your pain. All right, but it'll get better or whatever. I guess I was kind of felt like they didn't really provide a really holistic approach. And that's not to say that all PTs are like coming from there. And there's many schools of PT, right? There's old school PT school, new school, or like those who are maybe more holistic, so to speak. Relatively recently, I found more, especially a lot of the content that is helpful for me to manage my chronic pain does come from a lot of physical therapists too. But the thing about pain management is that it's kind of like a specialty area. And what people have learned maybe kind of like not the latest and greatest research, or they may be really kind of manual therapy based. So manual therapy in terms of like manipulating the body and just really anatomically based and not really working with the mind. So that's kind of a preview about what I'll be talking about, the mind. So what else have I tried? Chiropractic. So chiropractic, I think, just long story short, is I went on it pretty early, but I don't think it really helped me overall. Or whatever it did do, I met its kind of potential there. And it can really work for other people. For example, my wife goes really consistently and it's kind of like a maintenance thing for her and she feels a lot better. But for me, as I was getting my adjustments, even like 2 years post-accident for my low back, like I sometimes felt like twinges that I didn't feel like from any other thing else. Like it was only when I go to chiropractic where I felt like this kind of twinge in like a nerve or something, like on the side that I've never had pain before. So it was really weird. So probably like mentally or psychologically, it started giving me kind of anxiety. Like, oh my God, am I re-injuring like what's going on in my body? But for what I've looked at in terms of the research from my condition, in terms of the tissue injury, my condition should have healed pretty like early on. 2 years, definitely. Like I have no like tissue damage, so to speak, in terms of physical. So learning about that recently is reassuring. But what I've kind of done was I kind of taken the passive approach in terms of like not being really active about my pain. I've tried the thing where I kind of like rested a lot, like rest, and that worked. But the moment I try to, live my life and do anything at all, I experienced pain. And then I started having like a lot of anxiety and worry about things like my job, how am I gonna live my life, how am I take care of my kid, So that was my pain story. And ironically enough, even though I knew and went to school for OT and I talk about these tools and I advocate for these tools, I did not use them for myself. Like, I don't know why. It's just maybe because it's like one of those things that my wife says is like, you say things and you advocate for things and it's easy to like talk about it. But until you experience something for yourself and you're in that situation, it's like, you really don't know how things will go or how you'll behave or especially how you will think. So I was basically, the word is catastrophizing. Like I was like, oh my God, I'm doomed, so I was really down for a moment. So I think I attributed a lot of my management of my mental health to the antidepressant and my provider's support for that. But I didn't really take the complete holistic approach and take a step back, like a broader view of myself and look like, hey, like this is what I know about pain, what I don't know about pain, and then the third is what I can do about the pain. My TENS machine just turned off, so I'm going to turn that back on. Everywhere I go, I like even go to the store and drive with it, so I'm on a pretty low level, but it's awesome. And for people who experience pain, especially chronic pain, chronic being more than 3 months, a lot of people go through what's called the boom bust cycle. Boom, like going up and doing a lot, like go, 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 like being really gung ho and doing a lot of activities. And I was like that for a moment. And bust is kind of basically you hit a peak or you do something and you have a pain flare up, and then you go on to you hit the really big bottom and you like lay down, don't want to move, that kind of thing. So that's the bust. So, and it goes in a cycle. Like I want to do something, I hit that pain, I will go back down and like, I don't want to do anything again. And then it kept repeating. And this went on for like 2 years. And I didn't really, think about it because I didn't even know that I was in the boom bust cycle. So having that insight now is like, oh my gosh, like that was what was happening. And I could have really helped stop it by knowing more about, first by knowing that it was going on, and then two, learning about how I can manage it. And the right approach really isn't just to do as much as I can or do as least as I can. It's more of having insight into somewhere in the middle and doing what I can when appropriate and resting when appropriate. So it wasn't, and I really attribute a lot of what I really learned in the past few weeks to a friend that I met online who happens to be an occupational therapist. And we reconnected after COVID and, after life happening. And she asked me how I was doing with my pain. And I told her what was going on. She's like, wow, like here, let me share with you some resources. And she shared with me some podcasts, some people like occupational therapists, physical therapists, and books. So I started like really doing a deep dive into it. And those of you who know me, like when I go into like content that I'm really like curious about, like especially when it interests me personally, I like really go into it. So I found out about two, I think, very important things that really helped me for pain. I guess is turning more into a pain video is the book Explain Pain, which really explains pain from a kind of to a patient, and it's really intended for a patient from kind of a pain sciencey kind of approach, and then what to do about it. And the second was a podcast episode that I heard basically about an occupational therapist who happened to have a very similar story as mine. She, was practicing and then she experienced a chronic pain. And then it wasn't until she found out about doing OT for herself and on herself that she finally was able to cure her own chronic pain. So I'm on that kind of path myself right now. And I'm learning about chronic pain because, we learn about pain in OT school. And ironically enough, we learn about all these techniques and what they are and all these interventions. But you kind of like don't really think about it and like, what's the word? Like add up the 2 from the 1 + 1 until like you really critically think about it. But ironically enough, like all the research that I'm finding and like what works is like, oh, I learned about this in this semester, or I read about this in this continuing ed like article, or in this practice magazine, or in this podcast. So I guess the reason for making this video is to really inspire you guys about how occupational therapists really helped me to get my life back, to manage my chronic pain and other mental health things too, like anxiety and depression and, changes in my life, like lifestyle changes, identity and role changes. And I didn't actually go during this whole time. I really thought about seeking out mental health services, like seeing a psychiatrist or talking to like a LMFT. But like it was around the time of COVID-19. This was like 2019, 2020, 21. So mental health practitioners were swamped, and they still are swamped. And like I emailed and reached out and messaged like tons of practitioners that I was really willing to see. Like I wasn't willing to see in like every single one. I wanted someone I could relate to, like a male, for example, or someone who was like from my same culture. And so I had no luck with that, and that kind of fell into the background. But that probably could have really helped me. And I think having that kind of adjunctive service in terms of mental health. But I think the cool thing about OT is it kind of ties everything together. Like I'm wearing my OT shirt today, let's get functional. But occupational therapy really is about helping people to do the things that they want to do that are meaningful to them. And for me, like it wasn't exercise like the PT prescribed, or it wasn't like chiropractor where it's kind of, I'd say like a passive approach. Like you show up and then they kind of like adjust you and then you come out and you leave. Like they didn't like really, although I really love the chiropractors that we go to, like they didn't really give like a holistic approach. They say, oh, like drink water, but like really they did not really touch on the mental health aspect of it. And a lot of pain education in terms of like from the where patients kind of go and seek out don't really touch upon that. Like if you think about it, like if you had surgery or whatever, they say, okay, you think about what medications got. It's probably number one, what medications should I take? Or there are two, like physical therapy. But three, I think mental health is probably like last. And even then it's not really talked about in terms of like the whole like holistic picture. And that was really the missing piece for me in just really realizing how that can really help me. So what has and is continuing to help me is both, I use a combination of cognitive behavioral therapy, CBT, and mindfulness, and just really thinking about the moment, because a lot of studies have shown that both of these strategies and our interventions and schools of thought can help with managing your chronic pain. So I think that's really cool because everyone experiences pain like one time or another, whether it be chronic. I think as people age, a lot of elderly do show signs of more chronic pain, probably just from the wear and tear of our bodies. So, you know, we go to school for learning like how to do 1+1 and like study like, I don't know, English. But in terms of like life management skills, we don't learn about pain. And I think occupational therapists are really well equipped and they have a really unique lens to help people manage their pain. And I'm excited to be one of those practitioners who really has had that lived experience myself, who can really speak to it in terms of like chronic low back pain. So one thing that you guys can really be really proud of is how we can really help change people's lives for the better. And we can really tie a lot of these things together because yeah, having a doctor or having a PT or having a mental health practitioner is great, but having the OT as part of the team, I think adds so much more value because at the end of the day, we want to do things that are meaningful to us, and OT can help get us there using our perspectives and our theories and our interventions of actually doing those actual things. And a lot of what's helped me recover is like gardening, for example. It wasn't exercise, it was gardening that, if you think about it, has a lot of exercisey kind of things in it. You know, you're doing stretching, you're reaching around, you're lifting things. And although those things cause me pain, if I really think back upon it and like reflect upon it, like I was able to do a lot of things in terms of like gardening despite my pain. And a lot of that has to do with just how OT revolves around it and doing those meaningful activities. So applying that to other areas of my life, like childcare and like taking care of my kiddo, or my work and finding my work-life balance, or even my leisure, I think are those missing pieces where I can really just quote unquote get my life back and do what I really want to do to live a fulfilling life in terms of being happy myself, but also, and for my family, but also to help other people like you, and how we can all be happy using OT as a guide and as really it's a profession. You know, it's not a job like you go there and show up 9 to 5. It's really your identity, and it's something we should all be proud of. So hope this video was kind of insightful, was kind of rambly, but have a nice day. Thanks for watching.